All right, we're live. This is our first Facebook Live video chat. We just want to give an opportunity to introduce ourselves, what we do, and kind of change the narrative on surrogacy. We want our surrogates and anyone involved to be informed so we can kind of shake some of the stigmatisms or some of the questions that might come along with the process. So my name's Noelle. I am a case coordinator here at NewCare Surrogacy. This is...
I'm Kiri. I am a 4-time surrogate. And I also work here at NewCare as a coordinator.
Terrific. All right, so a little bit about us. We kind of make our focus on our patients. Like, this is not for us, it's all very personal. Everyone has been affected by one way or another by either infertility or surrogacy, egg donation, so that's why we all made it a point to get involved, and we really show that extra level of care. So we know when you're considering surrogacy, there are a lot of questions that pop into your mind. And it's one of those things, there are a million different variables. So we want to be there to inform you through the process and make sure you're comfortable in the entirety of it. So we'll kind of go over some of the general guidelines for surrogacy, answer some of your live questions. We have some questions that came in from you guys ahead of time that maybe can't make the live chat. So we'll go over all of it, and if you have any questions at any point, feel free to reach out as well. So, general overview first?
Yeah.
Okay, so we'll start with the requirements to be a surrogate. So these aren't necessarily requirements that we force upon anyone. These are just general requirements, some of them required by the FDA to be a surrogate, because we want you all to be safe and have a happy, healthy pregnancy without any crazy increased risks. So Jessica will read the general requirements that we have. These are pretty much across the board. So Jessica, you want to read those out for the viewers?
Yeah, so you must be between the age of 21 to 37 years old. You must have regular menstrual cycles. You must have had at least one successful live birth with no prior pregnancy complications, no more than 2 C-sections. You must be a non-smoker and, of course, non-drug user. BMI below 30 but up to 32 may be considered. You must be a U.S. citizen or permanent resident, and you must be financially stable and physically and psychologically healthy. You also must be willing to take injectable medication and obviously willing to commit to the whole process because there is quite a lot to do. And yeah, we have a couple questions here. Why, for the requirements, why do you consider 21 to be the age to become a surrogate and nobody younger than 21?
So basically it's a risk factor, and these are regulations that the FDA kind of figured out with doctors and professionals. Younger than 21 and older than 37 to, it goes up to maybe even 40, but obviously you have to start the process a few years prior to. There are just increased risks to carrying and delivering a baby. It's totally possible. We have plenty of people that delivered their own children when they were 19, 18, 20, and there's plenty of women that have had babies when they're 40, but the risk factor does increase. So in order to make this a safe, happy, healthy process for you guys and for the parents, we stay within the parameters and the guidelines that are granted to us by doctors and by the FDA.
Great. And what about the C-sections? Why no more than 2 C-sections?
So with C-sections, you do have, obviously, a cut that's in your body, and it heals up. But if you have multiple C-sections, the risk of that opening and, again, causing any complications is increased. So we have to limit it to the certain number.
And a lot of our potential surrogates want to know about the BMI requirement. Can you go a little bit more into that?
For sure. This is honestly my least favorite. I know plenty of moms, my sisters, everyone kind of struggles, gains a little bit of weight after they have a baby, struggle losing some of that baby weight. Again, this is a requirement only for your safety. We're not here to judge anyone or say because you're a certain weight you can't carry a baby. It's just there's risks of high blood pressure, which leads to maybe preeclampsia. This is the reason why we want to make sure you're at a lower BMI and a healthy weight that's established beforehand, because we know you're obviously going to gain some weight through the pregnancy, and we don't want to put anyone at any increased risks.
And how long does somebody have to take the IVF medications and do the injections?
So every doctor has a little bit of a different protocol. I'd say on average it's maybe 3 weeks. Some doctors go a little bit longer. I don't know that any really go any shorter.
No.
But that's just prior to the embryo transfer. So you're going to continue your medications up to 12 weeks of pregnancy. And throughout the process, you'll go to monitoring appointments. They'll do blood tests to make sure your hormone levels and everything looks good and see if there needs to be any adjustments to the medications.
Great. And then we did have a question about what is the first step to becoming a surrogate? Like where does one get started?
This is it. I feel like you're there. Just getting yourself informed, I think, is the first big step, and making sure it's something you're comfortable with, and maybe even starting that conversation with your loved ones, a spouse, your family, and then get in contact with us because we're happy to walk you through the process and make sure you're comfortable and you're informed about what it is. We'll go over everything kind of in this chat, so this is a great place to start. But then from here, you fill out an application. That's the next step, is filling out an application. It asks a few more detailed questions, a little bit of medical history, because we want to make sure there's no huge disqualifying factors in there. Again, another one that tends to be a little bit big is your state of residence. There are a few states that just don't, they have very strict surrogacy laws and they don't permit surrogates. I know off the top of my head, New York is one of them. I want to say it's Louisiana, Michigan, Wisconsin.
Those are the three I know.
Okay. So we have to make sure you're in a surrogacy friendly state. So we're not just looking at your application like, oh, is there any serious health history? We're also looking at where do they live. California is the most surrogacy friendly state. It has the most established laws for parentage. So everyone's looking for surrogates in California, but there are plenty of other states that, especially bordering states, that it's just as clear the law, and we're happy to work with. And we're willing to work with surrogates from anywhere as long as the law permits them to be a surrogate in that state.
Okay, awesome. And then we have another question from Instagram. Do you need health insurance, pretty much? We have somebody who currently doesn't have health insurance, so she would like to know how that works in becoming a surrogate.
Yeah, that's an awesome question. Do you want to field it? I can totally do it. So we use something here that it's a program specifically for surrogates, for IVF, and for a pregnancy journey. We will get you covered if you're not covered. It doesn't have to be during open enrollment. We can get you covered at any time. And it's a plan that covers all your OB costs. It covers your co-pays. So there's, regardless of whether you were billed, the agency and the parents pay for everything. But with this specific insurance, it takes care of everything. It covers all your costs. So you never have to worry about any of that.
Okay, perfect. And we got quite a few questions about the pain level of the injections. So people want to know, do the injections hurt?
Number one question. That happens a lot. I am not a surrogate. I've never been a surrogate. I've never had a baby. So I guess I'm like a really bad judge to say anything, which is why I respect you guys so much, because it's incredible. But Carrie has done injections several times, so she can probably give you the best input there, and I'm sure she has some tricks on how to ease some of the pain.
I do. Okay, so some surrogates end up getting their husbands to do the actual injection for them into their body. I've done all my injections myself. It doesn't hurt more than a pinch. Of course, it's a needle. You're gonna feel something. I personally ice first, so I don't feel the needle going in. After, I use a heated up rice pack to help the medicine disperse faster. But yeah, if I can do it, you can do it. I don't like it. I don't like needles one bit, but I've done it 4 times.
Yeah. I mean, you guys are all troopers. Anyone who's considering surrogacy is already a parent.
Yeah.
So I think it's, in comparison to
Childbirth.
having a baby, it's probably not so bad.
No.
So what happens if the parents decide that they don't want the child anymore, that they're not fit for parenthood after the surrogate is pregnant?
So we actually get this question fairly often as well. Just like we screen you guys, we go really thorough through your health history, and we do some interviews. it's even more thorough for intended parents. We do our due diligence and make sure they're fit to be parents, they're capable of handling it emotionally, physically, financially. So, and these parents work so hard to go through this process and to get a kid. It never happens that they just don't want it. That's not a thing that even exists. So I know girls often say, well, what if all of a sudden I'm at the hospital and they think this is my baby? No, you have the contract that lays everything out clearly. That's signed obviously way before the transfer. And then at 20 weeks around, they start processing something that's called PBO, pre-birth order. That's like a legal document that's a judgment from the courts that our agency will actually bring with them when we go, because we like to be there for your deliveries as well. You'll have a copy, we'll send a copy to the hospital prior, and the parents, the IPs, will have a copy as well. So the parentage is clearly established, there's never any questions about it. So situations like this just don't arise.
All right, so Michelle just wrote into our live chat. Hi, Michelle. Thanks for joining us. She wants to know how long it takes for a surrogate to be matched with the intended parent.
So this process kind of varies. It depends on a lot of factors, some that we just discussed. The state that you live in, some parents come in with a conception of what they want, like what state they want, what characteristics they want, and sometimes they'll hunt for that perfect match. But we want to make sure you guys are comfortable with the match just as much as the parent is. So generally, I'd say matching can take anywhere from the quickest to about a month, because again, when we're matching you, we're also gathering up your medical records. We're making sure you are physically fit to be able to carry. We're doing a phone call where you can talk to them, because it's important for you to be able to talk to them and get to know them. I'm sure you've talked to your IPs prior to, and them to get to know you. It's not just that they say, oh, I want to work with you. You have the option to say whether you want to work with them. So there's a lot of different factors that go into matching. Sometimes it happens super quick, but I'd say the average is anywhere from 1 to 4 months probably is on average. You get matched and we start moving along the process. Again, sometimes it's super fast. I'd imagine if it was a California surrogate who's been a surrogate before, who has a very good history, is young, a low BMI, she would probably get matched very quickly. Yeah. So some of those factors do have an impact.
Okay, perfect. And then a lot of people want to know about the compensation and the structure of it, and pretty much just how we decide who, how much they get paid. So can you go over the structure of the compensation and what the numbers usually are?
Yeah, so I'll kind of talk about the industry kind of average and the standard, and then I'll talk about a little bit about our structure. So first thing off the bat is, as a surrogate, as an individual, you're entitled to request any amount that you want. You set the rate, but that also has, weighs on the choice of the IPs on who they're going to work with. I'd say the average outside of the state of California base compensation for a surrogate is somewhere around $30 to $35,000 for a base compensation outside of California. Inside of California, I'd say it's around 40 to 45. Again, that's as a base, and that's as an average. We actually pay a little bit higher than most agencies. I think I've actually only ever heard of one agency ever paying anything more, but I don't know their bonus structure, so I think it all comes out in the wash. I think we're one of the top paying agencies out there, and we match faster than most agencies I know. And our base compensation outside of California is $40,000, and for California surrogates, it's $50,000. And then we have some bonuses too. You want to tell them about some of our bonus, our initial medical screening, and
including the amounts?
Yeah, you can let them know.
And that's for first-time surrogates, correct?
First-time surrogates, yes, great question. If you're a repeat surrogate, it increases. Again, it varies. You can set your own rate, but the general average is each repeat cycle is a $10,000 additional. I'm sure that's kind of what you've experienced as well. And then, some of the things, again, I know everyone looks into this, and we love that. Like, I love that, yes, you should be doing this because you want to help another family and because you're emotionally involved. But yeah, that's a huge perk. You get to help your own family as well, and there are lots of benefits for you. Some of the bonuses that we do offer is for going to your initial medical screening where we're checking everything out and making sure you're all good. You get a $100 bonus because we understand it's taking time out of your schedule. And we want to make sure you feel appreciated by us through the whole journey. We also do a $500 bonus when you pass all of your medical examinations and your psychological examination. We do a $500 bonus when you complete legal. We do bonuses when you do your embryo transfer. So there's a ton of bonuses kind of along the way that add up. So yeah, when all is said and done, it's probably, close to an additional like $5,000 just in bonuses. So yeah, and then we always have more earning potential for you. I love when there's surrogate sisters, I think they call them, when you get people kind of on board to do a surrogacy journey at the same time as you. You can bring a friend along, recruit a friend, you get a bonus for that too, and you both get to go through the experience together and you can kind of
support each other.
Yeah, I'm sure that's important, and that's it. Did you have any surrogate sisters?
No.
You didn't?
No.
Maybe one time you will.
All right, great. So, are there any health risks to being a surrogate mother? A lot of people want to know about, are there any health complications that can arise from being a surrogate? What are the risks, if any?
So basically the risks that come with being a surrogate are the same risks that come with carrying out a pregnancy. Pregnancy in general has risks to it. There's always risks. Why we keep those general guidelines and requirements is to minimize those risks, just like it would be with any normal, happy, healthy pregnancy.
Okay, great. And then also somebody wanted to know, actually I get this question a lot through our Facebook messages as well. What happens if the intended parent is in a different state than the surrogate? How does that work?
So our intended parents and our surrogates generally live in different locations. That's not uncommon. We connect them at some point so they're able to communicate freely and share their journey. Sometimes IPs will go to appointments, big milestone appointments. Did you have your IPs join you on any of your heart-type appointments, ultrasounds?
Sometimes.
Yeah.
I was going to say we do our video chats too.
Yeah. We make it a point for them to be involved, and then prior to the pregnancy, to your due date, they'll be in the area at least 2 weeks prior. And so we understand that due dates sometimes shift depending on how you're developing, how your body is behaving. So if due dates shift, we always make sure to get the parents in the area 2 weeks prior.
Awesome. And we have somebody saying hello. Her name is Jessica.
Hi, Jessica.
Thank you for joining us. Okay, perfect. Jessica, let us know if you have any questions for us. So does it cost the surrogate anything? Do they have to pay? We talked a little bit about what they get paid, but is there anything that they have to pay for themselves?
So you're offering an incredible gift to someone by even volunteering to go through this process. So the cost to you, there shouldn't be any.
Right.
So sometimes you'll have to pay. I mean, I guess imagine if you're coming to your appointment, you might have to pay for the gas to get here. But we reimburse you. We send you that $100. So at the end of the day, you get reimbursed for any expense that you might have to pay out of pocket. But we take care of all the billing. We make sure if you have appointments with doctors or anything like pre-consults and stuff that we can call and we can handle all of that prior to. We don't want to put any sort of financial burden on you, obviously. And we understand that someone wants to make the commitment and wants to help someone. We'll give them the tools to do so. We don't need any other requirements outside of that,
So we have a lot of surrogates who have also looked at independent journeys. So going, without an agency, what's the benefit of going with an agency?
So we could literally do, and we probably will, do some sort of live chat or blog post or something about this. There's a lot of people that do try to do an independent matching, which if it works for you and you're that type of person where you're super diligent and super organized and can keep it all together and you have a lot of free time, then maybe that's the best thing for you. But when you use an agency, we gather everything for you. We put in the legwork. There's a lot of stuff behind the scenes, and when we go over the process, you'll kind of see, I'll explain some of it. There's a lot of stuff that goes on behind the scenes and a lot of work that needs to get done that it's like a full-time job. And I think your primary focus as a surrogate should be keeping yourself healthy, happy, energized, and dealing with your pregnancy symptoms as opposed to dealing with maybe paperwork or appointments or things like that. Like So you get that full support the entire time when you have an agency. I like to say with us, we're super supportive and the most supportive, but I'm not here to judge.
So Jessica just wrote in, she wants to know what happens if she's overweight from her last pregnancy. When can she become a surrogate? And, can you talk a little bit about that?
Yeah, that's a great question. I field phone calls and intake from a lot of different surrogates, and oftentimes, I've had girls that called me while they're currently pregnant and said, I enjoyed this pregnancy, I really loved it, and I know I want to do this again, and I want to help someone. We do understand that losing that weight can be a little bit of a struggle, the baby weight. Shoot, my sister, sorry, I love you, she took like 7 years to get rid of her baby weight, so it took some time. We encourage you to a healthy commitment, to a healthy weight loss after. We do need you just for health reasons to be at the BMI that's acceptable. So obviously we want to aim for under 30. And we're happy to try and help you get there too. I stay somewhat active. I have some workout plans that might be helpful, but basically just getting your body moving and committing yourself to a healthier diet, that'll get you there. I know it's a lot harder because when we have babies, we tend to be a little bit older, our bodies change and they want to retain some of the weight. So we're happy to encourage you to get to your weight loss goals, whether it be for this journey or just for life. We want to empower all women.
Awesome, great. Miranda just wrote in. She's one of our previous surrogates, and she was also one of our coworkers. So hi, Miranda. Thank you so much for joining. Okay, what is probably one of the most common questions that you get as a coordinator?
Oh gosh.
I know there are a lot.
Realistically, this I get, when am I getting paid? Comes a lot as a coordinator. And we always keep you informed. We keep you on a somewhat regular schedule. After the pregnancy is confirmed, that's when the base compensation kicks in. So you get obviously all the bonuses prior to. The base compensation kicks in after, and it generally gets paid on the first of the month. So that's kind of regular. The bonuses are kind of as they come. Yeah. So we get that question fairly often, and we send you, when you start to join our program, we send you something that kind of spells it out, what to expect when, and if you just keep a copy of that, it's easy to follow along, and we're pretty good about remembering when someone needs that moolah.
Awesome. And Jessica just responded and said that she really wants to become a surrogate. So yeah, hopefully you can join the NewCare team, the NewCare family. Let's see. Is there anything that you guys have to say?
No, if we think it's beneficial, I can go over a general overview. I know we were fielding a lot of questions up front. I can go over a general overview of the process so you know what to expect, if you think that's kind of beneficial to go through now.
Yeah, you can go through the process. Great. Go for it.
So, this is in a nutshell. Again, this is one of the reasons why you want to use an agency is we're super informed. We know the process. We know the things that can pop up at any times. But step one, after this, maybe watching this video and getting informed, and you're going to fill out an application. We're going to review the application. We're going to make sure everything there lines up, confirm it with you, have an interviewed phone call. We do want to get a chance to talk to you beforehand. I want to make sure you're comfortable moving forward. I want to make sure you're informed moving forward. I'm not the type of person, and I think our agency stands behind all of us and loves the fact that we are super caring. I'm not the type of person who wants to pressure you into any sort of decision or even pressure you into our agency. I just want to give you the information and you find out if it's the right fit for you. And I encourage you to look at whoever you want to look at, because I'm so impressed by our standard and our care and our benefits that I think you'll come back to us pretty much every time. But so we go through that process of interviewing you, having that phone call, reviewing that application. Then we'll gather some documents from you. We'll need your ID. We need to verify your identity, obviously. We'll send you our paperwork, which is our surrogate benefit package. Again, it spells out what the payments are and when. It has some general paperwork as well, our agency agreement.
Don't be overwhelmed.
Yeah, it's probably overwhelming in the beginning because it's I think 20 pages of documents. Yeah. It's quick reads. Most of them are just like write your name and sign at the bottom because it's a medical release. Yeah. But I think as a surrogate you realize in the beginning it seems like a lot, and then the pregnancy is the easy part, right? So we gather all that stuff from you. We start working on getting your medical records and confirming that everything matches with your applications and there's no serious problems that we think would put you at risk to have a happy, healthy pregnancy. Then we'll schedule like another call with you, maybe a video chat, have your family, your spouse involved. We want to make sure that everyone's super supportive of the process and that you feel the support. And if you have questions or spouses have questions, like, we can answer them. We have someone who's been through the whole process, worked through the whole process. So we've gotten most of the questions and we're happy to find the answers for you if we don't know them. But we encourage that call as well. Do we have a question coming in?
Yeah, we have another question from Michelle. She wants to know, can a surrogate use their own OB?
Absolutely. We'll go about, when we go over the process and the pregnancy, we'll kind of cover that. But the short answer is when you're about 8 to 12 weeks, it's just like a regular pregnancy. You go to your own OB, you see your own doctor who you're comfortable with, you deliver with them at your own hospital. We don't make you see anyone particular once you're cleared into the pregnancy.
Yeah.
Yes, you graduate, right? Graduate to your doctor is the term they call it.
Awesome. And then we have another question from Jessica. She wants to know, how does the surrogate become pregnant? That's a great question because we didn't really touch on, if you're biologically related to the child. So can you explain that process?
Yeah. Do you want to field it?
Okay. So no, you're not biologically related. The egg comes from either the egg donor or the intended mother. And the embryo is created by the IVF doctor mixing the intended father or sperm donor with the egg. Creates the embryo, and then the IVF doctor, honestly, it sort of reminds me of a pap smear. He uses a catheter to put the embryo gently inside your uterus, and it grows.
There it is.
So
That's kind of the
the
process.
most important is you're not related.
Yeah, we do get that question a lot, and I think that's because broadly everyone uses the term surrogacy. Surrogacy is like a more familiar term to people.
Yeah.
When you use the term gestational carrier, people are like, oh, what's that?
Yeah.
They don't know what it is, but they know what a surrogate is. Technically, everyone that we work with is a gestational carrier. You're just carrying the embryo that is of no genetic relation to you.
Right.
Traditionally, a surrogate is someone who has a genetic relation, the intended mother. So we don't do that. It's everyone's a gestational carrier. That's a really common question, and we'll actually do a blog post about that as well to kind of clear up some of that misconception.
So what about the relationship between the intended parent and the surrogate? How does that work? Does the surrogate have a relationship with the intended parent and also the child as well?
So we want it to be super organic. That's our goal, is like every relationship develops organically. We can't put any like, this is what it's going to be and this is what's going to happen. We just kind of let it develop naturally. So you do have that video chat in the beginning. That's that first base of your relationship. Generally, because it is a very emotional process, most people like to kind of develop that relationship a little bit deeper after the heartbeat confirmation, because it's hard to get attached super early on, because it's IVF and we never really know the outcome. Yeah, so we want to make sure there's no stress on anyone, and we kind of have a lot more communication after that heartbeat confirmation. You do video chats regularly. I've had some girls that I see them talking back and forth with their parents every other day. They'll just communicate with them and say, oh, this is what happened today, or oh, I felt baby kick, and that's great. But there's some girls that are also maybe a little bit more shy, maybe not as outgoing. We kind of take that into consideration when we're matching you too. I always ask girls, have you thought about the type of relationship you want to have? Do you want to be the person who gets updates and birthday cards every year? Or do you want the person who just thinks like, you know what, I really want to do this for someone, I want to help a family and through the pregnancy, and that's the only involvement I want? That's great too. We will match you with like-minded people. So we encourage you to let that relationship develop organically, but we also will match you with someone that we think kind of has the same jumping off point.
Awesome. We have a couple more questions and we're going to start wrapping it up soon. So if you have any last minute questions, please write in. Cassie wants to know, how are the financial issues handled?
in terms of billing, I assume is what she's meaning. If you did by any chance get a bill, I don't know, maybe it squeaked through the billing department or the insurance or whatever, you send it to your coordinator, we take care of it for you pretty much instantly.
Yeah.
We don't want to ever put you guys in a stressful situation or a situation where a notice is coming to your house or you're like, oh my gosh, I have this bill sitting here. It just doesn't happen. Like, we will take care of it quickly. We have an accounting department in-house who makes sure that all of our billing is dealt with same day. So you don't ever have to worry about that. That stuff should never be a concern. Your concern should be growing this baby, staying healthy, staying happy, and we'll deal with the rest. That's the benefits of having an agency kind of by your side as opposed to managing it on your own.
Awesome. And then Jessica asked a couple of questions that we already touched on earlier, so we'll kind of just briefly revisit those. She was asking about taking medications as a surrogate mother, and can you touch on a little bit about the medications again, really quickly?
On the injections?
Yes.
So the injections we kind of reviewed earlier in the video. You can go back and play it. We'll leave this on a play on our page so you can check that out. But you do have to take some injections. There's ways to minimalize the pain. For her, it was just a pinching. I don't think it's a very painful thing. I've done injections before. It's not painful to me, but we respect everyone's feelings, and that's part of the process. You're a warrior. You had a baby, so this is nothing for that.
And are there health risks with that medication?
Associated with medication?
Yeah.
No, you're going to be monitored throughout. We do blood tests. Once you start medications, there's blood tests every few days to make sure your hormone levels are regulated at the right frame. So if there was an increase in hormones, that would be a risk to you. Or if there was too little of hormones, we make sure to monitor it so that we minimize those risks.
Okay, perfect. Awesome. Are there any last minute things that you guys wanted to touch on that you think are important?
We could finish going through the process, but we could save that for another video chat if you think that's better too. We got to the application and the matching and kind of halted there. So we want to do a quick roundup of the rest of that?
Yeah, if you could briefly go over it. And then before that, Aisa, I'm so sorry, Aisa, yeah, she just wanted to say, I love this agency, Noelle is the best. So, just a little shout out there. But yeah, you can go ahead and continue talking about, yeah, go
All
for
right.
it.
I know, we always get distracted with the questions, and I get so into it, so I'll try and keep on track. So yeah, the application process, we get that paperwork back for you, gives you a little bit of expectation of what's coming next. Then we'll work on matching you while we're working on the guidelines. Again, we'll try and make it so that's a match that we think is suitable for you and perfect for you. We want to make sure everyone's comfortable moving forward. We do a video chat. We oftentimes have parents that speak another language, so we have a translator, and we use a chat feature later on too that translates for you so you can communicate throughout. It's never an issue. Carrie, I, myself, and maybe one other person aren't bilingual. Are you bilingual?
I speak French.
Oh, well then I guess, wait, are you bilingual? Okay, maybe it's just me who's not bilingual. We make sure there's somebody on the call to translate for you if necessary and that you're comfortable, but that's that match call and that approval. Then from there, we send your medical records over to their IVF doctor where their embryos are. Make sure you're approved for them, and then we'll have you come in for a screening to that particular doctor. If you're out of state, most of our doctors are in Southern California. If you are out of state, we'll fly you in, maybe for the night, maybe just for the day if you're close enough. And you'll get that medical screening, which will have sometimes a saline ultrasound, which we can talk about in a later post too. Yeah. Not too bad, again, you had a kid. So then after that, you get the results back. It takes about 2 weeks. We make sure everything's good, everything's comes back good on your blood work. We do a blood work for your spouse as well if you're married. We're just looking for random, like we want to make sure there's no drug use or anything that's going to cause harm or increase risks during pregnancy. Once you're medically cleared, we take you to legal. That should be pretty simplified since you've already signed a benefit package. You know what to expect. We kind of just implement that into a legal contract. You have your own attorney, the IP has their own attorney, and you guys kind of just communicate. You review the contract with your independent attorney. once the contract is signed, that's when you'll get your protocol from the IVF doctor. So protocol, calendar, whatever they call it, that's when you can start the injections. You can't start any medications or injections until after that legal is completed. And that, again, is generally, a month until embryo transfer. So we also base it on your cycle, based off your period. So sometimes we can time things a little bit and control it when you're on birth control. Sometimes we just are waiting for periods. But we're pretty efficient, man. We move it along fairly quickly, and we do the best we can in relation to how your body's reacting. We try and get you prepped and ready to go, and we let nature do its thing. So as you're taking the medications, your lining will develop. We want to make sure it's good and thick and ready to be cushy for a nice embryo, and it'll hang in there. So they'll be checking you again throughout the medications to make sure your body is reacting the way that they anticipate it to, and they can make changes if they need to at that point, at any point. Then you do the embryo transfer. You're gonna rest for a few days. We'll have you out by the clinic at a hotel, making sure you stay in bed and kind of give the embryo the best possibility to carry out to a full-term pregnancy. So then from there, you get to go home. You'll see an IVF doctor or your monitoring clinic for your first few weeks, and we'll see if it all came true, if it all happened. And usually around 8 to 12 weeks is when you'll see your own OB. And then you carry out the pregnancy just like your own normal pregnancies and typical pregnancies. Again, we'll process that PBO around 20 weeks, and then we'll have the video chats and things so that you get a chance to establish that relationship with your parents if that's something that you want to continue on with and to do. And that's kind of it in a nutshell. I know it was super fast and there's a lot more, and you might have many questions, but this is just the first of one of our live series videos. We're going to do some more of these. We're going to do some vlogs. We're going to do, what else are we going to do?
We're going to have a lot of events that we're planning. So if you guys have any ideas about events that you would like to come to or any activities that you want to do, Noelle, do you want to kind of just touch on the ones that we are brainstorming right now?
I'm having a brain fart, and all that's coming to my head right now is a yoga event. Probably because I'm a little yogi, and I want to do all the yogs. But we're encouraging moms, new moms,
paint night,
older moms, paint night, to come out and just get an opportunity to be somewhere social with their kids and learn about opportunities that they might be able to benefit their parents, especially if they had happy, healthy pregnancies, and bring joy to someone else's life. I mean, these parents, by the time they've gotten to this process, they've gone through usually years of trying to conceive on their own. And it's heartbreaking, right? Like, all they want is a kid, and they couldn't go through that process without our amazing surrogates, right? So they're thankful for you from day one. The fact that someone is so selfless to be able to want to help another family, it's just incredible. I'm in awe. Like, every single time I think about it, every single time I get to do a phone call like with a surrogate, and I talk to them, and they talk about, like, one of my questions that I ask is like, why are you considering this? What first made you get the idea? And just to hear their stories, whether they're impacted by someone with infertility themselves, or they just have a really giving soul. Like, I get choked up, man. I hope I can be a surrogate one day. Maybe after I have kids, I'll get to give that gift to someone too. But I think you're all freaking rock stars.
And one last question before we go. Jessica wanted to know how she becomes a surrogate. So what is the first step that she should take after watching this video?
Fill out the application. On our website, it is www.usnewcare.com. We will post a link to it as well. You fill out the application there. That's step one. It'll take probably 25 to 30 minutes to get it completed. There are some medical questions down at the bottom, so we just want to make sure we have it in its entirety. And then we'll reach out to you and kind of go over the next step and guide you through.
All right, awesome. Any last words before we sign off?
Carrie, you did great. First live video. I think this is my first live video too. You did a terrific job. I'm proud of you. I'm proud of the team for putting it all together. Sorry we're a little bit late. First timers. We're going to figure it out. And if you guys have any ideas about any topics you want to have us kind of talk about or approach, you can comment.
Send us a message.
Yeah, and we're more than happy to either make a new video, throw up a blog post, host an event near you maybe, if you have some friends that you think might be interested but want the information.
Share this video.
Yeah, we're just here. We're trying to change the narrative of surrogacy, right? Like, we want this to be something that's empowering and encouraging. And I think sometimes people are almost like embarrassed or ashamed, and they're like, oh, I don't know. And it's like, you're a freaking superhero. I would shout it to the rooftops. I will be that girl that's got like the surrogate shoes and the surrogate backpack and the t-shirt, and I'm just like, yeah, rubbing the baby bump. So I think everyone should approach it like that. I understand that everyone's like a little bit different, and like Carrie's already like now like, oh. But that should be you. That it's an incredible thing that you're doing, and nothing that you should ever be like not happy to share with others. And we'll probably do a blog post or a video about that topic as well, about how to talk about it with your family, open up about it, or with your friends, because I know Carrie, you know, obviously her spouse knew that she was going through this process, but with some of her friends, maybe not even her closer ones, it was a conversation she wanted to breach delicately. So we can talk to you about how that process kind of goes too, because
Family, friends, kids.
Yeah.
Explaining it to
I actually, Amazon's delivering some books today. I've got like 4 different books about surrogacy, kids books that I want to get out to people. Yeah, for sure.
All right. Awesome. Well, thank you so much to everybody who asked questions, either during the live chat or through our Instagram or Messenger. We will definitely be doing more live videos, so keep the questions coming in, the suggestions coming in, and thank you so much for joining us. Bye, guys.
Thank you. Bye.